Hello everyone and welcome back. My name is Bilkis Ali. I am an RN and Certified Director of Nursing and Administration and Long-Term Care. If this is your first time tuning into my channel, I want to say thank you and welcome. I hope you find this video and all my other videos educational so that you can improve yourselves in your facilities. Today I wanted to give a couple tips out on our discharges. Yesterday I spoke about admission, so let's just talk about the discharge process while we're in the same spectrum. So, like I said yesterday, if you get a short-term resident, discharge teaching start in admission. Your discharge planning starts on admission. And you want to make sure what it is that you need to do to help that resident get home and get home safely. All right? So, and you always want to keep your resident and your resident representative up to date on the progress, okay? You already know we have a lot of family dynamics out there when it comes to our residents and them getting home, whether it be back to their families or another facility, such as assisted living or PCH. So keeping the family involved, especially if that family member is the resident representative, okay, or the power of attorney. So the day that you're going to actually be discharging your person, you want to make sure you have the actual discharge order with or without meds, if they're going home with or without home health, a DC appointment to their PCP that is in the community. Your discharge summary should already be open and you want to make sure it is complete. Okay, you want to make sure that your MDS coordinator has it documented in the assessment of where the location of the person is going, okay? You're going to return the meds to the pharmacy, destroy narcotics, okay? Your med reconciliation form, and that list of, all of your medications and the count on them. Your personal belongings sheet, we talked about this yesterday. You want to make sure that when your residents are coming into your facility that personal belongings sheet is completed, because this is where they will sign again to say, yes, I, Bilkis, have my all of my personal belongings. Your DC note, this is always important, okay? You really want to make sure that you're documenting where the person is going, what happened to the meds, and what happened to the narcotics. Not only that, take it a step further. I always tell my nurses, get a set of vital signs and do an assessment. So when I'm discharging, my notes should look something like, Bilkis was discharged to home, vital signs are XYZ. Skin is intact. She ambulated to the car with a walker and assistive one. Staff assisted her into the car. She was pleased with her care here. No concerns, okay? Something simple. It just gives a standing point that that's a closure, all right? Like I said, anything we start, we want to make sure we close it. We started when they came in with an assessment, and we're going to close it with an assessment, okay? You're going to close out that care plan. All your discharges, they get faxed to your ombudsman. And then audit your chart. Okay, auditing your chart is important. You want to make sure that everything is in there, it's signed, all the documentation is there, and that's where you're going to be working with your medical records person. A couple videos ago, I said how that medical records person is essentially your compliance person. Okay, they make sure that those charts are complete and up to date. And then, as always, you want to make sure that you return equipment. So if your resident, say they had, for example, like a low air loss mattress, and you need to return it, okay? You want to return it like as quickly as possible because we want to be cost effective. Okay, we don't want to pay for equipment that we don't necessarily have to. Now, if you were to have a resident who left AMA, okay, that's a big thing, okay? Some things are beyond our control. All right, residents, they have rights. And if you have a resident that goes AMA, before they go AMA, try to take necessary steps to encourage them to stay there, all right? Identify the root cause for the resident, why the resident wants to leave AMA. What steps did you do to prevent it, okay, from occurring again? So like if it was a system breakdown, all right, in your process for whatever reason. What are you going to do so that it doesn't happen again to any future residents, okay? And then you want to try to encourage them to stay long enough so that you can still provide a safe discharge. Even though they want to leave AMA, we still have to make sure that we did everything that we needed to do to ensure that it is as safe as possible, such as appointments, going home with home health, what are they going to do for meds, okay? And keep in mind, like you residents, and I've had this happen before, not for a resident to go AMA, but the resident was discharging, and no, he actually was discharging early, right? He wanted to leave, and I couldn't get that prescriptions, that prescription was filled, so I had a hard time getting it filled in the community. It was a long process, okay, because it was filled, and then, the facility that I was at didn't want to send the meds, so try to make sure that you really have their medications for them, okay? Of course, you're going to alert protective services and just say, hey, by the way, Bilquis wants to go home. She is adamant. She doesn't want to be here. She has been in and out of the hospital, and now, she's been in and out of several facilities. She just doesn't want to be here. She's leaving AMA. We have done everything. Everything is documented. We got her home health. We got her an appointment with the family doctor, and she's discharged from her meds. Okay, because like I said, we still want to make sure that the process is complete. Okay, we want to make sure we are discharging our residents back into the community as safely as we can. Okay, so those are my tips on discharges. Okay, so if you like this video, please like, comment, and subscribe to my YouTube channel. As always, visit my website for all your nursing purchases. Take advantage, schedule yourself for the survey prep course, or enroll in my overall program. All right, I hope you guys have a wonderful day, and I'll talk to you soon.